Good day, everyone. My name is Hui Xu from Pokyang National University. It is a great honor to participate in the 2025 Summer Domestic Conference and the third International Conference of the Korean Convergence Technology Society. Today, I'm pleased to present my research titled Understanding User Intention Toward Medical Escort Platforms, an integrated technology adoption framework based on task technology fit and the extended technology acceptance model. I look forward to sharing my findings and exchange ideas with all of you. The structure of the paper is as follows. The first section, Introduction. The second section includes theory and research model. The third section includes data and methodology. The fourth section, exam results. The last part includes discussion, conclusion, and limitation with future research. The first section, Introduction. Next, I'm going to introduce research background of this paper. Aimed at accelerating population aging, shifting family structure, and uneven healthcare resource distribution, public demand for medical escort service is growing. In response, escort service platforms have emerged as digital support systems. The National Internet Plus Healthcare strategy has further fueled their development, with the number of online healthcare users surpassing 418 million. Despite promising market potential, these platforms continue to face challenges in user penetration and service quality, underscoring the urgent need to systematically investigate the key mechanisms and technology task alignment that shape user adoption intention. Now, I'm going to introduce innovation point of this paper. First, it innovatively integrates task technology fit theory and extended technology acceptance model to construct a multi-level structure model of technology fit, cognitive evaluation, behavioral response. Second, the model incorporates a change mediation mechanism and a multivariate task design, systematically revealing the dual mediating role of perceived usefulness and shaping behavioral intention, thereby refining its central position with the ETAM framework. Third, by incorporating the features of medical escort service, the model includes two key variables, perceived security and perceived professionalism, enhance its explanatory power and applicability to his service platforms. Fourth, the model reveals that task technology fit influence user decision-making through multiple pathways. The second section includes the theory and research model. The task technology fit theory proposed by Goodhill and Thompson emphasizes alignment between technological capabilities and user task requirements. It predicts that when a technology is well matched to the demand of a task, it significantly enhances user performance and adoption intention. It has been widely applied in the fields of information systems, mobile learning, and digital healthcare. Empirical studies have shown that high task technology fit not only enhance perceived usefulness, but also reduce operational effort and improve system usability and trust. The task technology fit theory provides a critical theoretical foundation for understanding the relationship between platform functionality and user behavior in the context of medical escort service. technology acceptance model emphasizes the influence of perceived usefulness and perceived ease of use on user behavioral intention. To improve its applicability in high sensitivity contexts, TM2 and TM3 introduce variables such as social influence and technology anxiety, thereby broadening the model's explanatory scope in the healthcare domain. Factors such as perceived security, privacy, and professionalism have been shown to significantly influence users' technology adoption behavior. Therefore, they started incorporating perceived security and perceived professionalism into model to enhance its explanatory power in the setting of medical escort platforms. The integrated application of TAM and TTF offer a more comprehensive analytic framework for understanding technology adoption behavior. TM focuses on user subjective perception, namely perceived usefulness and ease of use, while TTF emphasizes alignment between technological functionality and task requirements, demonstrating significant theoretical complementarity. Empirical studies have shown that high-task technology fit can reduce operational effort and improve task quality, thereby enhance user perception of usefulness and ease of use, which indirectly influence their behavioral intention to use the system. In the context of medical escort platforms, the integration of TTF and the ETAM enable a dual perceptive approach that combines technology fit and user cognition. This study constructs a technology fit cognitive evaluation behavior response pathway to systematically explain user behavior, thereby enhance both the contextual relevance and the theoretical explanatory power of the model. Figure 1 illustrates the theoretical framework of this study. This study developed an explanatory framework for behavioral intention based on task technology fit theory and extended the technology acceptance model, aiming to reveal the interaction mechanism between technological attributes and user cognition during the use of medical escort platforms, as well as their multi-path effects on behavioral intention. The framework emphasizes multiple pathways through which task technology fit drive cognitive factors such as perceived usefulness, ease of use, security, and professionalism, and further influence user behavioral intention through perceived usefulness as a key mediating factor. Based on the above theory, the study puts forward the following hypothesis. H1. Task technology fit has a significant positive effect on user intention to use medical escort service platforms. H2. Task technology fit has significant positive effect on perceived ease of use of medical escort service platforms. H3. Task technology fit has a significant positive effect on perceived professional of medical escort service platforms. H4. Task technology fit has a significant positive effect on perceived security of medical escort service platforms. H5. Task technology fit has a significant positive effect on perceived usefulness of medical escort service platforms. H6. Perceived ease of use has a significant positive effect on perceived usefulness. H7. Perceived professionalism has a significant positive effect on perceived usefulness. H8. Perceived security has a significant positive effect on your intention to use medical escort service platforms. H9. Perceived usefulness has a significant positive effect on users' intention to use medical escort service platforms. H10. Task technology fit indirectly influence users' intention to use medical escort service platform through perceived usefulness. H11. Task technology fit indirectly influence user intention to use medical escort service platforms through perceived security. H12. Task technology fit indirectly influence users' intention to use medical escort service platform through perceived ease of use and perceived usefulness. H13. Task technology fit indirectly influence user intention to use medical escort service platform through perceived professionalism and perceived usefulness. The third section includes data and methodology. This study employed a structured questionnaire with measurement items adapted from prior TM and TTF studies and revised to fit the context of medical escort service. The questionnaire covered key variables such as perceived usefulness, ease of use, security, professionalism, and task technology fit. It was distributed online to Chinese users via the questionnaire star platform in November 2024, yielding 521 valid responses. Table 2 shows results of descriptive statistics. The fourth section in explain results. The measurement model was assessed using Smart PS for 0.1.0.9. Normality tests indicated the skewness and kurtosis value for all items were within acceptable range, supporting the assumption of normal distribution. All standardized factors including exceed 0.7, conforming adequate indicator reliability. Composite reliability value were above 0.8 and average various extracted value exceeds 0.5, indicating satisfactory, discriminate, and convergent validity. Overall, the measurement model demonstrated strong reliability and validity. As we can see in Table 3, there is a good differentiation between the latent variables in the study. As shown in Table 4 and Figure 2, task technology fit had a significant positive effect on all mediating variables. The strongest effect is observed on perceived professionalism, beta equal 0.737, with pass coefficients for perceived ease of use, security, and usefulness being 0.646, 0.712, and 0.527, respectively. These results support hypothesis H1 through H5. Additionally, perceived ease of use beta equal 0.156 and perceived professionalism beta equal 0.202 significantly enhance perceived usefulness, while perceived security beta equal 0.175 and perceived usefulness beta equal 0.266. Further have significantly positive effect on utilization, supporting hypothesis H6 through H9. The mediation analysis results indicate the task technology fit significantly influence usage intention through perceived usefulness and also through perceived security. These findings support H10 and H11. H12 indicates that perceived ease of use and perceived usefulness jointly exert a significant mediating effect between task technology fit and usage intention. Indirect effects equal 0.027. Similarly, the chase mediation effect of task technology fit on usage intention, while perceived professionalism and perceived usefulness is significant, supporting H13. Table 4 shows path relationship of the hypothesis test results. And the figure 2 shows structural model analysis results. The last part includes discussion, conclusion, limitation, and the future research. This study empirically validated the integrated influence of task technology fit and extended technology acceptance model on user intention to use medical escort as service platforms, with all hypotheses significantly supported. First, task technology fit not only directly influence usage intention, but also exerts indirect effects through perceived ease of use, professionalism, security, and usefulness, serving as a key driving factor. Second, perceived usefulness as the core contract of extended technology acceptance model play a central mediating role across multiple paths and acts as a crucial bridge linking task technology fit with behavioral intention. Third, perceived professionalism and security as variables enhance users' perception and usage intention from perspective of social, psychological trust and technological trust, respectively, thereby extending the theoretical scope of the NTAM in highly sensitive healthcare setting. Overall, the integrated mode of TTF and ATAM effectively capture the full process of users' transition from technological alignment to cognitive evaluation and behavioral response, enhance both explanatory power and contractual applicability of the model. The theoretical contributes of this study are reflected in three main aspects. First, this study integrates task technology fit theory with the extended technology acceptance model to construct a closed-loop logic from technological alignment to behavioral intention, thereby enhancing the model's explanatory power in complex healthcare. Second, it highlights the central mediating role of perceptive usefulness by revealing its integrative and transformative function across multiple transmission pathways, thereby deepening the understanding of cognitive mechanism underlying use adoption. Third, by incorporating coverage variables such as perceived professionalism and security, the study enhances the adaptability of the TM in highly sensitive service contexts and extends the application boundaries of technology acceptance theory with the domain of digital health service. This study process for policy recommendation to promote the high-quality development of medical escort service platforms. First, platform functionality should be optimized based on use task orientation to ensure effective alignment between technological features and healthcare service process. Second, The professionalism of escort service should be enhanced through trust-building mechanisms to strengthen user perceived professionalism. Third, data security governance should be improved by introducing dedicated policies and safeguard user privacy and ensure platform compliance. Fourth, inclusive digital health should be promoted by integrating platform service into smart healthcare, thereby improving technological accessibility and user capability among vulnerable population and advance healthcare equality and service inclusiveness. This study has several limitations, including the range of samples, the use of cross-sectional data, and exclusion of AR-related factors. Future research could expand the sample scope, incorporate social-emotional variables, and integrate factors such as AR-related trust to enhance the model's external validity and contextual adaptability. And that's all. Thank you for your listening.